right, peace and greetings to you all. This is Omar Abdul Malik, physician assistant and health educator. So I just got off my night shift as a hospitalist PA. For those of you guys that don't know me, I'm a hospitalist PA here in Washington, D.C. So I thought I would talk about the vaccine, since it's now being offered. I think we're in the second week, I believe, if I'm not mistaken, the second or third week of the COVID-19 vaccine being offered. So I'm planning to take mine next week, God willing, inshallah. So clearly there's a lot of controversy about the vaccine and the virus. So I've been trying to educate people about the virus to the best of my ability since it first started. And this has been almost a year now. It's been several months. So some people are calling it a plandemic, suggesting that it's planned. And I don't want to get into that because it's just the theories never end. They're endless. Some actually have some degree of there's varying degrees of credence to people's theories about where the COVID-19 came from or who made it. But I want to talk about the vaccine. So, and my, how it pertains to me as a clinician and me as a African American male. So, there's been a lot of folks that have asked me, am I planning to get the vaccine? The short answer to that is yes. I say yes with this caveat that I may or may not get side effects from it. Either those side effects may or may not be felt immediately, or maybe days or years from now. I don't know. It's the same thing with the virus. We still don't know what the virus will do to people long term. But I'm planning to get the vaccine. I think it's important for me to set an example as a clinician to let people know that they don't necessarily have to be afraid of the vaccine. And as an African American, we have just cause to be wary. Things like the Tuskegee experiment, in which black men were not given syphilis. I will argue that to the hilt. They were not given syphilis. They had syphilis. The clinicians, the white clinicians, wanted to follow the course of the disease and did not offer these African American men treatment for syphilis. This is just as insidious, but it is not factually correct to say that they were given syphilis by the white clinicians, any more than it is factually correct to say that black folks were given HIV. I have treated HIV patients for 20 years now, and I got black folks with HIV who are absolutely convinced that the white man, or the powers that be, or the powers that are, gave them the virus through the air or contrails or in the drinking water, or and it's unfortunately during my almost 2 decades of treating people, it's led to some people dying unnecessarily because they would not take their medication. So that's another topic I think I'll get into. So I'm taking the vaccine because I think I need to set a good example. Number one, I want to protect myself and others. I personally believe that if I were to contract COVID-19, I don't think I would be suffering the same degrees of symptoms that a lot of people do. I think I suspect, just given my baseline very good health, thank God, alhamdulillah, I think that I would be an asymptomatic carrier or a low symptomatic. So it might present as the sniffles or a very low-grade fever. And if you've seen me on my Instagram, I take my temperature every day before going into work. I've got a wall thermometer. So I would not want to risk getting COVID-19 and passing it on to others because I feel pretty much fine, and passing it on to others who've got very, very compromised immunities. I work with very sick patients. They've got varying degrees of acuity. Some have got full-blown AIDS, cancer, very poorly controlled type 2 diabetes mellitus. All of these things are things that lower one's immunity and make them more privy to suffering from diseases, whether it's a bacterial, viral, or fungal infection. And so I want to protect other people first and foremost. My family, I've got elderly parents, and also my colleagues and my patients. And we've already had outbreaks at various hospitals where a clinician will get COVID-19, not realize that they've got COVID-19, and then unfortunately spread it to patients. I mean, this is devastating, not just in terms of what it does to the patient population, but also the burden of guilt. I mean, I wouldn't want to live with that. So for me, it's worth the risk to myself getting the vaccine. So, people may call me a sucker or a sellout, but I'm going to do what I have to do to protect those around me. And people have got, I think, I'll talk briefly about why people feel so adamant about certain things. I had a man, I was doing my trail run yesterday. I was in the woods, basically, and I had my mask. I'm wearing it now, and I'm fiddling with it, trying to get it over my face, and I ran past this elderly gentleman, but I was quite a ways away from him. I make it a point to run in places that are very sparsely populated, and he yells at me, "Jay Dan, put on your mask!" as I'm fiddling with it, and I was offended at first because I was like, "Oh, this guy cursed me out." But then I had to think about things from his perspective. Here it is, very clearly a very elderly man. Maybe he lost a loved one. Maybe his spouse to COVID-19. People are dying from this disease, and here I am, like breathing, without the mask covering my face. And I will tell people that the mask does not keep COVID-19 virons from going through the pores of the mask. The virons are infinitesimal compared to the pores of this porous mask. It's like trying to keep fruit flies out of your house with a mesh fence. The virons are very, very tiny. You need an electron microscope to see them. But I think it's just the idea that wearing the mask does give some protection from various expectorant. And I think it gives those around you a kind of a sense of security. So in that sense, I definitely try to be considerate and almost always have the mask on when I'm out, or when I'm running and I pass by some people. This time I didn't. I was like, I didn't get it up in time. But that experience really it let me know, like, look, people are really, there's a lot of controversy concerning the mask and the vaccines, and everybody on both sides, I think, have got valid points, whether you're for the mask or against the mask, for the vaccine or against the vaccine. But God willing, inshallah, we'll work this thing out Now there's talk of a new strand of COVID. I'll do another video on that, inshallah, God willing. But, you know, I'll let you guys know how it goes once I get the vaccine next week, inshallah, if I have any side effects. But I wish you guys the best of success in your positive endeavors. If you're interested in becoming a physician assistant like myself, please subscribe, and I'll try to give you some advice, and you can also contact me on Instagram. Take care. Peace. Be safe.